Hello, everyone. I'm Chris Berry. I am an assistant professor at Colorado State University. It was a sincere honor to be one of the winners of the AMA-EBSCO Responsible Research and Marketing Awards this year, and it's a great pleasure to be able to share this research with you all today. I'm going to be presenting on a topic that my co-authors and I call the calorie labeling paradox, and I'll be presenting on behalf of myself, as well as my co-authors, Scott Burton, Elizabeth Howlett, and Christopher Newman. This research was driven by a number of concerns, one of which is concerns related to obesity. So 70% of American adults are either overweight or obese, and this is the second leading preventable cause of death in the United States, behind only smoking. Specifically, obesity is related to about 300,000 deaths annually in the US alone. The other issue is that food consumption clearly plays a role in obesity. Specifically, food prepared outside the home tends to be higher in fat and higher in calories, making it a major contributor to this epidemic. In addition, Americans consume about a third of their overall calories on these foods and spend about half of their food budgets on food prepared outside the home as well. These foods were initially exempt from nutrition information mandates, such as the Nutrition Labeling and Education Act of 1990. And it wasn't until much more recently, specifically May 2018, when restaurants became required to disclose calories on their menus and menu boards. And this was after years of consideration by the FDA and others, as well as a number of years of research across disciplines and research by a number of individuals, including my co-authors. And it was finally again in May 2018 when restaurants with 20 or more locations became required to disclose calories on their menus, menu boards, as well as their online ordering platforms. Despite this major marketplace change, there's actually minimal evidence at this time to support menu calorie labeling as a strategy to influence consumer behavior. So there were a number of field experiments, both between subjects field experiments, as well as longitudinal experiments that were being conducted based on cities and states that were requiring calorie labeling, that began to conclude, again, that calorie labeling was ineffective. Here's a quote based on a 2015 meta-analysis that concluded there's minimal evidence to support menu calorie labeling as a strategy to directly influence consumer behavior to substantially reduce calories purchased at restaurants. However, my co-authors and I took a marketing lens to understand that consumers' individual differences matter. Specifically, consumers differ in how they derive value from food. In other words, the attributes that consumers are striving to maximize for the money that they spend is going to be different across consumers, and these differences could obscure both increases and decreases in calories ordered, providing an explanation for the non-significant effects or the weak effects that have been found to date. So for example, a consumer that was concerned with maximizing the healthiness of the option for the money that they were spending may strive to order fewer calories, whereas a consumer that was striving to find the tastiest or the largest quantity of food for the money that they're spending may actually order more calories in response to calorie labeling. To examine this issue, we conducted a number of pilot studies to develop psychometrically sound food value orientation measures, and based on extant research, we identified the attributes of health, taste, and quantity as particularly relevant, and therefore developed food value orientation measures for these specific attributes. We then went on to conduct both between subjects online experiments as well as longitudinal experiments to understand the effects of calorie labeling on calories ordered and specifically understand the moderating role of food value orientations. After these studies, we then went further to conduct a field experiment at a fast casual restaurant to bolster the external validity and again examine the interactive effects of calorie labeling and food value orientations. With these data, we used hierarchical regression to explain why many field studies conducted prior to these across many disciplines have shown non-significant or trivial effects of calorie labeling on calories ordered or calories purchased. Our key findings based on the longitudinal and the field experiments were that calorie labeling was only effective in reducing calories ordered among health value-oriented consumers. That is, these consumers responded to the information by ordering fewer calories. However, these effects were counterbalanced by those who value taste and value quantity, who in aggregate actually responded to the information by ordering more calories. So as an example of this interaction among health value-oriented individuals, I provided the following plot from the field experiment. So these percentiles represent percentiles on health value orientation. Specifically, the higher percentile, the more someone values health. And so what you see here is that health value-oriented consumers respond to calorie information provision by ordering fewer calories. However, those who value health to a lesser extent may actually respond by ordering more calories, although those lower percentiles do not reach significance. These series of studies provide some evidence of the asymmetrical effects of calorie information provision, and most importantly, they identify reasons for counterbalancing effects that have led to the weak and overall market-based outcomes that have been found in extant research. These findings were influential in how restaurant chains, the public health community, and agencies consider how to present calorie information to address both the national and the global obesity epidemic. And they continue to be relevant and influential as other countries, such as England, move forward with calorie labeling mandates. A number of stakeholders were involved in the development of the studies. This research benefited from input from the FDA, including discussions at an FDA menu labeling workshop, also discussions with a number of state agencies, NGOs, as well as restaurant chains. This research was ultimately published in JPPNM and has been and continues to be of substantial interest to the FDA, the restaurant industry, and the multidisciplinary academic community. As some examples of some of these things, this research has been provided to the FDA. It's been presented at a number of special sessions at both AMA and the AMA Marketing and Public Policy Conference. Some press releases have been developed and disseminated to the media. I conducted an interview with the Colorado Ag Today to discuss these findings, and my co-authors and I, by invitation, have discussed these findings at a number of universities, including Villanova, Stony Brook, Nebraska, Utah State, and Colorado State. That concludes my discussion today. Thank you so much for your time. For your convenience, I put my contact information here. If you have any questions or comments whatsoever, I would really appreciate you reaching out to me. Take care and have a great rest of your day.